Hi, I'm Angie, your healthcare guide. Today we're tackling two very confusing healthcare terms: referrals and prior authorizations. What are they? What are the differences? And when do you need one? I'm here to break it down with real examples. So let's figure this out together. First, let's talk about referrals. A referral is when a provider recommends you see a different provider or have a specialty test completed. For example, your primary care provider recommends you see a specialist, a cardiologist, or a dermatologist, or they want you to have specialized imaging, like an ultrasound. It's like a permission slip from your provider to get specialized care, but it also tells the specialist why your provider is sending you to see them. Let's take a look at a summary of benefits and coverage for a Blue Cross Blue Shield HMO plan. Now, referrals are common with HMO plans or health maintenance organization plans. These plans often require you to see your primary care provider first, who then refers you to a specialist if needed. See down here below? You need to have a referral to see a specialist. Without that referral, the visit might not be covered. We see in this Kaiser SBC that patients can actually self refer to certain specialists. This would be something you would need to reach out to your insurance company to confirm so that you can make sure those visits will be covered. And finally, a Regents SBC showing that no referral is needed to see a specialist. Here's a little insider tip, though, from my time working in many specialist offices. One thing often heard was, but my insurance doesn't require a referral. While this may be the case, many specialists require referral as a way to make sure that you are making an appointment for the right thing in the right place. Surgeons, for example, may specialize in different procedures and different parts of the body. Without a referral from a provider, a surgeon may not know exactly what's going on without doing their own diagnostic assessment. And this is typically done by the time you get to that surgeon's office. For some specialists, say dermatology or gastroenterology, you may not require a referral to be seen. It's best to ask the office when you're calling to schedule an appointment with that specialist. Primary care providers are well versed in providing referrals for care and procedures. You may need to see that primary care provider first to confirm that the referral is needed and it's going to the right specialist. But it's more of a matter of making sure you're being directed to the correct specialist for the right thing. Now, prior authorization, sometimes called pre authorization. This is when your insurance company needs to approve a specific service, treatment, or medication before you get it. It's their way of checking to make sure it's medically necessary. For example, prior authorization may be required for surgery, a specialty medication, an MRI, or an inpatient hospital stay. If you don't get it approved first, your insurance might not cover the cost. So, what's the difference between that referral and prior authorization? A referral is going to come from your provider, and it's usually for seeing a specialist or having a diagnostic imaging service. It's about coordinating your care. The prior authorization is from your provider going to your insurance company. And the authorization is for approving those specific treatments or medications. It's really about cost and necessity. Here's a catch, though. Sometimes you're going to need both. For example, your HMO plan might require a referral to see a specialist and a prior authorization for a procedure that specialist recommends, like surgery. Let's take a look at a few real life scenarios. First, Sarah. Sarah visits her primary care provider for a skin rash. Her primary care provider determines that she needs to see a dermatologist. Sarah has the HMO plan that requires a referral. So her provider gives her a referral to see that dermatologist. Without that referral, her insurance won't cover the specialist visit. Now let's meet Tom. Tom sees his primary care provider for stomach pain. His primary care provider determines that he needs to have an ultrasound. Tom has a PPO plan that does not require a referral, but his insurance requires prior authorization. Tom's provider is going to submit that prior authorization request, and once the insurance approves it, that ultrasound is covered. And finally, Lisa. Lisa sees her primary care provider for knee pain. Her provider determines that she needs to see an orthopedic surgeon. After that visit with the orthopedic surgeon, it's determined that Lisa's going to need surgery. She has an HMO plan that requires a referral. First, Lisa's going to get that referral from her primary care provider to see the orthopedic surgeon. Then, her insurance is going to require prior authorization for the surgery itself. Both steps are needed for coverage. Make sense? That was the difference between referrals and prior authorizations. I hope that cleared things up for you. On your healthcare guide, we will keep breaking down topics like this every week. Things like, what do the acronyms HMO, PPO, HD, HP really mean? And in-network versus out-of-network. What does this mean? If you have a confusing healthcare topic that you'd like me to cover, leave a comment below. And if you like this video, please subscribe, like, and share. Thanks, and I'll see you on the next one.